Hello everyone, Dr. Boyd here. Welcome back to Parently. Today we're going to talk about a very complex diagnosis, preeclampsia. I'm going to end up doing several videos on preeclampsia because of the complexity of the disease. Today we're going to diagnose the problem, give you the clinical assessment, and how doctors manage it globally. And then in separate videos, we're going to talk about how we're going to manage preeclampsia mild and preeclampsia severe, as well as superimposed preeclampsia with somebody that has chronic hypertension. So I want to give a background and a preview of what preeclampsia is and how it's diagnosed. Preeclampsia is a complex disorder that causes elevated blood pressures or hypertension in pregnancy. It's pregnancy specific, but it's multifactorial and affects many organs. It affects the blood pressure, therefore it affects the heart. It can affect the kidneys by decreasing the outflow. It can affect the brain, and there are women that have seizures and even strokes and even die from this condition. 5 to 7% of all pregnancies will end up with a diagnosis of preeclampsia. Most women have mild preeclampsia, and we simply monitor it by weekly visits or daily visits in the office. Sometimes we have to admit patients, sometimes we have to deliver early. But most women have mild preeclampsia, and it's simply an observation of their clinical situation and their baby's situation. Now, who gets preeclampsia and why? All women that are pregnant can develop preeclampsia. It's a condition that causes elevated blood pressure and protein in your urine. In other words, when you urinate, you should not have protein being spilled from your kidneys. In preeclampsia, potentially large amounts of protein can be spilled, and that's how we diagnose it. Elevated blood pressure, usually 140/90 or greater, on 2 separate occasions in the office, with you in a sitting position so that your arm is at the same location as your heart. Sometimes we will lay you down in the office on your left side and we'll monitor your blood pressure. Usually women that have higher blood pressures, we want to lay down and recheck their blood pressure. Who gets preeclampsia? Simply put, all women, and I mentioned this, all women can get preeclampsia. Specifically though, women in certain categories are more likely to get preeclampsia. First of all, women that have chronic hypertension. This is elevated blood pressure that's diagnosed before your 20th week of pregnancy or after your 12th week of pregnancy at the end of your pregnancy. So any blood pressure that's 140/90, pre-pregnancy up to 20 weeks or 12 weeks after delivery is by definition chronic hypertension. You should already be on a medication in that scenario. So you present to your doctor on your first prenatal visit, and we need to know your blood pressure. And we make that diagnosis of, do you have chronic hypertension or do you not? Now, most women obviously don't. So if your blood pressure increases later in pregnancy, after your 20th week, to ranges of 140/90 or greater, and then we diagnose in concert with that, protein being spilled from your urine, by definition, you have preeclampsia. And then we will categorize you as a mild preeclampsia or as a severe preeclamptic. Now, I'm going to talk about this in further videos, how that stratifies out. In other words, how you get managed as a mild patient with preeclampsia, how you get managed as a severe patient with preeclampsia. It's important to understand that your doctor, once you get diagnosed with preeclampsia, by definition, you're a high-risk pregnant patient at that point, and you need to be monitored frequently. Not only do you need to be monitored, but your baby needs to be monitored as well. How do we do that? We either set you up and perform non-stress testing, and we can do that in the office if your healthcare provider offers that, or offers that in the hospital. That's simply where we hook you up to the monitor and make sure that your baby is giving a certain score that we categorize as category 1, 2, or 3. If your baby remains a category 1, which is the good score, then we simply continue to monitor you. Usually when you have diagnosis of preeclampsia, we see you on a weekly basis, whether you get diagnosis at 22 weeks or at 24 weeks, at 36 weeks or 38 weeks. However, if it looks like your blood pressure is higher, we tend to see you more frequently. Now, I've mentioned several times who gets preeclampsia. So, the 15-year-old and the 40-year-old. In other words, both ends of the spectrum. The mom that's very young in her life, the mom that tends to be older, they're at increased risk for developing preeclampsia. Women that are obese tend to have more risk for developing preeclampsia than if you're not obese. Those are some of the stratifications of how we look at women. Are you at increased risk for preeclampsia? I hope this was helpful today. This is a complex subject. This was kind of an overview. I'll talk more in detail with each video moving forward.